I guess they didn't want me to hear the meeting. Oh, well, I guess I won't listen to the board meeting. That's my new car! Hi, sweetie.
Hello. How are you?
Good. I was going to listen to the board meeting, but I couldn't.
Seatbelt.
Yeah, I couldn't get it in. So did they put a new battery in?
I'm going to go meet Rex, Marty Jones, my son.
Just
end of life and need to be replaced. Plus, we were able to find a new model to help fund this. We're going to be moving from Abbott, with your approval, to Rose. They're going to give us 2 new machines and a track system that is expandable. The good news is we're going to be able to save $350,000 a year by doing it. We're going to move from a cost per reagent contract to a cost per billable. So we don't pay anything until we complete the test and bill the patient for it, and then we pay Bruce a portion of that. Contract is for 5 years plus 1, $792,174 per year. There is a startup cost of $32,000 for interfaces, and then $960 a month monthly maintenance charge for that. Here to answer any questions you might have about this equipment before your decision.
What's the should I actually wrote it down. Maintenance on this is why it's under agreement today, pick up the maintenance on it, or what is that?
Yes, sir. It's all included because we don't actually have title to the equipment. It's amortized through the.
So the building is knocked down by a tornado, that equipment. I guess they carry the liability insurance on it too. I mean, if it's struck by lightning or something, it's all there.
Yeah, it's all theirs. It's all covered through this price per billable arrangement. There are some provisions in the agreement that we can purchase the equipment earlier to relieve ourselves of some of that operational cost if we choose to. But right now we have that amortized for the term of the agreement.
How many of these machines are there?
2 plus a track system. We'll be able to expand that later when we add hematology.
Okay, do I hear a motion?
I'll make a motion for approval. I'll second.
I have a motion and a second. Any discussion? All in favor say aye.
Aye.
All opposed, motion carries. And the Cerner amendment.
Thank you. This is actually very good news. We have, is Linda Carpenter here? She's on the phone. She's small, but let me tell you, she is mighty. We have been working with Cerner on this for about 6 months and just looking for a way for Cerner to help us out with some relief during this financial situation. And we were able to come to agreement with them for a $3,490,531 relief over the next 18 months. So they will be crediting our bills over that period. They let us out of some contract obligations, and we negotiated some consulting hours that they owed us to be able to do this. So net to us, just south of $3.5 million.
Is there a percent? How much of that is the total? Do you know off the top of your head?
Is it still getting
No, they can hear me.
it? They can have 1 or 2%. Look at the whole.
In the whole thing, but for this time period, it was a 20% reduction.
Yes. Yeah, it's significant. They will help us out a lot.
Make a motion for approval.
I have a motion and a second. Any discussion? All in favor say aye.
Aye.
All opposed, motion carries.
What if we selected the power
All right,
chart
and then
itself?
we're moving over to the Quidel Sophia
It was like the power
analyzer.
chart, so we
Yeah,
could
this is pretty
share
good
sorry,
news
what was
too.
it?
This is new
That was the
equipment
last
that's out on the
presentation.
market
He's
right
not
now.
showing anything.
And it's going to
Okay,
enable us to do rapid testing for COVID, flu, strep, and RSV. It is a reagent agreement, and they'll provide us 6 of the necessary pieces of equipment. 4 will go in the ER, and 2 will go in the lab. But this should provide us plenty of resources and capability to do COVID testing, and will improve some of the turnover in the, or cycle times in the ED. It is total 3-year agreement for $78,742.
Make a motion for approval. I'll second.
I have a motion and a second. Any discussion? All in favor say aye. All opposed, motion carries.
Thank you, board.
Thank you, Mr. Collins. Now we move on to the Stay-Well Amendment. Ms.
So can you hear me okay with my last one? Yes, that'll take it off. So the first one I have to review with you is called Stay-Well. It's actually a change in our contract. We currently do year to year, and so by going to a 3-year contract with this company, we can save about $11,000 over that time span. What Stay-Well is all of our discharge videos. We have about 1,133 videos currently. And all of those videos are shown if you have a new diagnosis, if there's some type of education needed prior to your discharge. So it's really a good educational tool that we have on our TVs for every patient in our facility. So that total, if we redo the contract, it'll be for a 3-year agreement with a cost savings of $11,000 by the time we get done with our agreement. And then, of course, it'll just start right back over again. Any questions?
Make a motion for approval.
I have a motion and a second. Any discussion? All in favor, say aye. Aye. All opposed, motion carries. All right, you have one more.
I do. So the second request I have is what's called a CNS replacement upgrade for our telemetry monitoring on the B side of our emergency room. Currently, it's probably 3 years past its service life. And what that is all the telemetry monitoring on that non-acute side of the emergency room. The issue now is that it's becoming very hard to maintain, and the physicians are not able to see it on the A side. So if there's a need for an A side physician to see those patients, they can't remote see those from their current location. They have to physically go over to the B side. We were planning on purchasing this through the fiscal year 2021 capital budget. But we visited with Neon Coden, and they're willing to give us a $16,000 cost break if we can purchase before October 1, or at least generate a PO for that. So that's where we decided we'd go ahead and bring it to you so that we can have a little bit more discount than what we anticipated for next year. Any questions?
What is the total?
Oh, I'm sorry. The total budgeted would be $35,033. And this actually gives us 20. It includes all of our side A bed or B beds, as well as our fast track, which is the 7 beds in the front of our triage.
Make a motion for approval. Second.
I have a motion and a second. Any discussion? All in favor, say aye.
Aye.
All opposed, motion carries. All right, and then you do have a capital expenditure request.
The last one I have is our BP sterilizer. Over the last week or so, you've received text messages that I have sent you regarding our sterilizer being down, and it's having to utilize Midland Memorial and Odessa Regional to sterilize our scopes and our instrumentation, lumens, the channels, those types of things. Our sterilizer, we have one existing. We've all ordered many parts and they have fixed that for us. So since we spoke last week, that is operational. The problem is that for about 5 years now, we've had a lot of service to that sterilizer. And what the manufacturer recommends is you PM every 6 months. You should be running about 750 loads, if you will. We run about 500 every month. So it's getting a lot of utilization, and so it's really wearing down that sterilizer. So the request I'm making tonight for the $148,839 is to have another sterilizer so we can split those loads, lighten the loads on the instrument or the sterilizers that we're currently using between the two, hopefully increasing the life of our others just a little bit, plus having a backup in case the one we currently have goes down again, where we're not having to utilize our partner facilities. Any other questions on the sterilizer? $148,839.
Make a motion for approval.
I'll second.
I have a motion and a second. Any discussion? All in favor, say aye.
Aye.
All opposed, motion carries. Thank you. All right, with that, we'll adjourn.